Hello, I am Dr. Sripadma. I work as an Associate Professor in Neurology with the Department of Kasturba Medical College, Manipal. Let's talk about stroke today. Stroke means that there is a sudden disturbance in the blood supply to the brain. That means either the blood has clotted in the brain or a blood vessel in the brain has ruptured. Now, all of us know about heart attack. Similar to a heart attack, the stroke is an attack of the brain. Now, how do you recognize it and why is it important? This happens very suddenly, gives you very little time. So what happens as a result of this? So this has been accounted by an acronym called as BFAST. So BFAST, B stands for loss of balance, E stands for any change in the eyes moving towards the side. F stands for facial droop. That means the angle of the mouth, it is deviated to one side. You notice that the facial expression of the person has changed. A stands for inability to lift the arm. S stands for any change in speech. All this, if you notice suddenly, remember, this could be a stroke. If it is recognized early, you can take this patient to a nearby hospital at the earliest. Time is essential, time is crucial. 4.5 hours. As soon as you see that a person has suffered a stroke, if you are able to reach a stroke-enabled hospital within 4.5 hours, then there are lots of treatment options that are available to us. As soon as you take a person with a suspected stroke to a hospital, this person will be received in the emergency. In the emergency, a CT head will be done. After doing a CT head, it will be determined the type of stroke that the person has. If the person has an ischemic stroke, that means the blood has clotted in the brain, then we have the option of removing the blood clot from the brain. This is called as endovascular thrombectomy, for which there are neurointerventionalist specialists available. Or else, this blood clot can be dissolved by giving thrombolytics, that is a clot buster injection, or tablets like antiplatelets or anticoagulants, which the doctor who will be seeing you will decide is the best for you. The other type of stroke that is known as the hemorrhagic stroke. This hemorrhagic stroke means that basically the blood vessel in the brain has ruptured. Once the blood vessel ruptures, there is a lot of blood in the brain. So if the patient has become unconscious or is not able to talk at all, not responsive, then the neurosurgeons can be called and the blood can be immediately surgically removed from the patient's brain. However, if the person is only complaining of headache and is still conscious, then we can give injections which will reduce the swelling in the brain that this hemorrhage results in, and the patient will have to be kept in the ICU care for a few days. The next treatment of the stroke is planned. Now, who can have a stroke? Can anyone have a stroke? The answer is yes. Stroke is more common in people who are more than 40 years of age, but that doesn't mean that people who are less than 40 years of age cannot have stroke. Has a lot of increased cholesterol level in the blood, or those who have a habit of smoking or drinking alcohol heavily, those who are taking any recreational drugs, even those people who have a habit of snoring at night. These are all people who are at a high risk of stroke. So when we look at the risk factors of stroke, it is clear that more than half the population in and around us, in our family included, are at risk of stroke. So once a patient is brought to the hospital and the treatment is administered, the treatment includes either removing the clot, doing a surgery if required, or starting the injection called as a thrombolytic agent. Today, science has progressed. We have excellent thrombolytic agents available like altiplase as well as tenecteplase. So as soon as you detect a stroke, rush the patient to the hospital immediately. Control of hypertension, diabetes, stop smoking, stop alcohol intake. This is what is needed. If you prevent a stroke or if you rush a patient to the hospital immediately, the disability can be largely prevented, and follow the doctor's advice. Thank you.